effectively, as is reflected in the title of your book, we have fallen into effectively a religious faith that the health of children depends on radical medical intervention. And it just isn't true.
I agree with you that, I mean, that's well said, and that any environmental insult can cause harm. I mean, vaccines are not the only one. They're forever chemicals. There's a whole long list of them. But to your point about chronic disease, in particular, chronic diseases that are that have an etiology from immune system dysregulation, those have exploded since the early 80s, right? There are data that reflect that under 10% of kids in America had a chronic health issue in the early 1980s, over 40% today. Some data reflect over 50, and often multiple and more severe. Seasonal allergies is one of the things that has exploded in that period of time as well as some of the other conditions you just described. And when you look at the conditions that have exploded, like asthma, atopic issues, allergies, even things like ADHD and some other neurological or they often have an etiology, or there's a lot of science supporting there's some kind of underlying immune system dysregulation. Well, what's caused the immune systems of our kids to dysregulate in mass since the early 80s to today? For that, my argument is start by looking at the product that you've gone from injecting 3 of in the early 80s by on or before the first birthday to 25 today, 29 if you count COVID vaccine, okay? Because it's a 3-dose series, by the way, for Pfizer's COVID vaccine to a newborn 6, 7, and 9 months. I don't know if you knew that. I would start there. And the studies that have done that, and they're often smaller because, major institutions have not typically published these studies. I'm not saying they haven't done them. I'm not saying the CDC hasn't done this study. I just know they haven't published it. That compare kids with no exposure, which is the way you're supposed to do science, unexposed to exposed, right? 0 vaccines to 1 or more. They are consistent. They reflect the kids who are vaccinated have multiple times the rate of these very chronic health issues that have exploded over the last few decades. And so there is serious cause for concern. That doesn't mean unvaccinated kids can't have health issues. Even in these studies, some of them do, but they're at far, far less rates than their vaccinated peers.
Yeah, and it reflects the question of net effect, right? The sales pitch on these things is, look at this disease and look at our intervention, and the overclaiming of benefits from the intervention is extreme, and the focus on the disease itself ignores the wider context. The only thing a parent should care about is my child net better off if I go with this intervention than not? And that's a far harder question to answer than those who are pushing these things